Hi, my name is Sarah Mason. I'm a nurse practitioner with Ochsner Health System, and I've been doing annual wellness visits for the system since 2014. I'm here today to train you how to do a Medicare Enhanced Annual Wellness Visit. Thank you for joining this training session. Training today is going to include a review of the purposes and benefits of the Enhanced Annual Wellness Visit, EAWV as we'll call it. It's part of an ongoing effort at Ochsner to streamline this service for our providers and for our partner provider network. The EAWV is an excellent opportunity to close care gaps and ensure our patients' health risks are appropriately documented. We're here today to teach you how to appropriately deliver this Enhanced Annual Wellness Visit to our Medicare Advantage patients and our MSSP or Medicare Shared Savings Program patients. For most people, this will be a 1-hour office visit where we collect this information, update health screenings, and provide risk stratification. The project will help improve the EPIC database of medical conditions. It's going to help coordinate care across the spectrum, address HEDIS gaps, and provide risk stratification. We'll talk about the purpose and history of an AWV, high-risk documentation, and we'll do a demonstration of a typical EAWV, including documentation in the EPIC electronic health record environment. Your system may differ. The purpose of the demonstration is to give you an example of how to use your EHR efficiently to conduct an enhanced annual wellness visit. What is an annual wellness visit? Well, according to Medicare, it's a visit designated to developing or updating a personalized prevention plan and performing a health risk assessment. It includes a checklist of required components that prioritize preventative care rather than addressing acute disease, chronic disease, or complaints. The required elements are a review of demographic data, a self-assessment of health status. In the EAWV format, we actually accomplish this through dialogue with the patient and relevant caregivers rather than having the patient fill out a survey. We also review family medical history. We do a medication and care team reconciliation. Psychosocial risks and behavioral risks will be discussed. We'll also do an assessment for fall risk, hearing impairment, and cognitive status. We'll talk about preventative planning, and we'll do a review of advanced care directives to make sure that patients are able to express their wishes on their future healthcare needs. The additional purpose and benefits of the EAWV are risk adjustment. Medicare allocates more weight and financial resources to patients with significant health needs. The sicker the patient population, the more resources Medicare provides for you to care for them. Through risk adjustment, Medicare determines how much to pay the health plan for delivering the right care to the right patient. They determine this through the ICD-10 codes that you document on your patient. And these codes need to be dropped every year to maintain the patient's risk stratification level. There are 4 parts to Medicare, as most of you know: Part A, Part B, Part C, and Part D. Part C is the Advantage plans, and the focus of these enhanced annual wellness visits is primarily our Medicare Advantage population. Medicare Part C includes Part A and B, as well as some additional coverage for vision or hearing services or supplemental services like gym memberships. The Medicare Advantage plan receives payment for each member from the Center for Medicaid Services. Payment is based on the Medicare member's predictive health status and on their demographic characteristics. The Advantage plans are regulated by CMS, and these plans pay for patient care using a capitated payment model. Capitation is a fixed amount of money per patient per unit of time paid in advance to the physician or hospital system for the delivery of healthcare services. So how you code determines your payment amount. Historically, risk adjustment was done just based on patient demographics. After 2007, CMS developed a new technique using what we call HCCs, or hierarchical condition categories, to determine a patient's risk. The hierarchical condition category model contains almost 10,000 diagnoses in 70 different diagnosis groups. How you diagnose and document your patient's health will determine how you're reimbursed by Medicare. If your patient has a number of HCC or hierarchical condition category diagnoses, it means they're at higher risk, and Medicare will pay you more money to take care of these patients. It's a long-term strategy so that payments are based on need and acuity of diagnosis, because we know that sicker patients require more healthcare resources. The managed care plans depend upon an accurate diagnosis to ensure that the appropriate dollars are available to care for each enrollee. As I mentioned, diagnoses must be reestablished each year to ensure that the next year's payments will cover the costs. For example, an amputation needs to be reported once per year to ensure that the service related to the condition is covered. Documentation must support each diagnosis that is reported. Why are we doing an AWV, you might ask? Well, according to research, there is a very large reduction in overall spending for patients that have a Medicare wellness visit. It's about a 5.7 reduction over 11 months for patients that have had an AWV. Additionally, for enrollees and beneficiaries who had an AWV, they were more likely to receive recommended preventative clinical services. The other benefit of the AWV is it provides us an opportunity to close our HEDIS gaps. HEDIS, or Healthcare Effectiveness Dataset Information, is a set of metrics reflecting screenings and guideline-based measures. Success is measured in stars. Plans with 5-star ratings can have open enrollment all year, can take members from non-5-star plans, and they get favorable reimbursement rates. Some of your HEDIS measures include breast cancer screenings, cholesterol management, colorectal cancer screenings, blood pressure control, and comprehensive diabetic care metrics. In cases of advanced illness and frailty, some of your patients may be excluded from the quality metrics related to HEDIS. Much like risk adjustment, frailty is demonstrated through coding. Let's review how you document on your high-risk conditions. The ICD-10 diagnosis codes paint the picture and drive the risk. The risk scores, as we said, drive the reimbursement from CMS to the managed Medicare plans. All diagnoses must occur as a result of a face-to-face encounter for the purposes of risk adjustment, and the services need to be rendered by a licensed provider, whether it be a nurse practitioner, a physician assistant, or a physician. To document correctly, the first thing you want to do is identify appropriate health conditions. You can do this through searching the chart for previous diagnoses. You can find what you may see on physical exam, for example, a patient who is morbidly obese. You can look for new diagnoses through your screenings. So for example, if your patient has a positive depression screening and meets the clinical criteria for major depressive disorder, you want to be sure to document that. You want to make sure that the condition you're documenting is active in the current calendar year. If it's not, and it remains on the patient's problem list, you should update the problem list to resolve the problem if it is not active any longer. The documentation is easier than you think. MEET. MEET stands for Monitored, Evaluated, Assessed, or Treated. In the EAWV, for every diagnosis code that you drop, you should make a statement saying that you have monitored, evaluated, assessed, or treated the condition. If you're treating stable conditions such as hypertension, you can say stable, followed by primary care provider, on amlodipine 10 milligrams, patient is compliant, or something along those lines. If your patient has a positive depression screening, you can assess it today and say that the patient has major depressive disorder. Their PHQ score today was above normal. It's up to you to put in the correct value for your patient, but you get the idea. The reason we're doing this, in large part, has to do with these reimbursement rates. As you can see, when you code specifically, your reimbursement rates go up if the patient has, for example, complications with diabetes. So if you code somebody as uncomplicated diabetes, but in fact they have multiple complications, you could be missing out on up to $4,000 a year for that patient. Risk adjustment is based on documentation. In scenario 1, where we're discussing the same patient through all these scenarios, none of their HCC diagnoses codes were coded, and so CMS calculates a payment of $5,292 a year. When we look over to scenario 3 and all relevant HCCs on this patient are coded, CMS calculates the annual payment at $16,245 per year. That's a huge difference for your healthcare organization. The pitfalls of the wellness visit are thinking generally, being complacent, overpopulating your problem list with things like symptoms or irrelevant diagnoses that are actually historical, and missing opportunities to close gaps while the patient's in the office. What we recommend is that you think specifically. Look for pertinent high-risk diagnoses, update the problem list with very specific diagnoses, prioritize the problem list as much as you're able, use the HCC Scorecard Navigator to guide you, use Epic to find the most appropriate diagnosis codes, and when you're able in your regular practice, link medications to your problems, please. Here we have a list of commonly misdiagnoses. These are all HCCs that get overlooked a lot. For example, atherosclerosis of the aorta is very common in patients above 65 and can often be seen on imaging studies, but it's also often overlooked. You want to make sure you're coding these issues. We call these the low-hanging fruit, and you want to try to capture them at every visit if possible, but specifically at the enhanced annual wellness visit where you have a little more time to sit with the patient and review their health risks. The physical exam at the EAWV is fairly minimal. You do the general appearance, assess if they're overweight, underweight, or obese, listen to their heart and lungs, check their bellies. If they are diabetic and they're due for a monofilament exam, please complete that. And look for any skin ulcers in at-risk patients. The remainder of this video will show a model enhanced annual wellness visit with an actress playing the patient. She is younger than the stated age of the patient. Please overlook that for training purposes. We're going to go over the recommended screenings and assessments and show you how to document an enhanced annual wellness visit correctly. Thank you all again so much for participating in today's enhanced annual wellness visit training. Good morning, Ms. Zest. I'm Sarah Mason. How are you today?
I'm okay. How are you?
I'm good, thanks. So we're here to do your enhanced annual wellness visit. This is a free benefit from Medicare, and all of the results and everything we've discussed today is going to be sent to your primary doctor.
Oh, perfect.
Okay, so let's get started. So the reason you're here is for your annual wellness visit.
Right.
And right now, are you living alone or do you live with someone else?
I live by myself and my little toy poodle, just the two of us.
Just the two of you? In your own home, apartment?
In my own home.
Okay, it's not a senior assisted living facility or anything like that?
No, it's a single family home.
Very good. And let's see. Your vitals look great today. Your blood pressure's in normal limits. I know they've been working on that.
Yes, I take my medicine regularly.
Wonderful. We're going to go over those in just a minute. Normally, do you walk with a cane or any sort of walker or assistive device?
No, not right now, no.
Okay. And in the last 12 months, have you fallen at all?
Well, about 2 months ago, I did have a fall, and then and I thought maybe I just stumbled, fell on a knee, and then 2 weeks ago I felt a little weakness on my left side and stumbled to fall again.
Oh dear, okay. So you've had 2 falls in the last year then?
Yes.
Was it the same knee that was bothering you both times?
It is.
Okay.
It's the left side.
So having that many falls does flag you as a fall risk in our system. And the purpose of this visit is preventative health. So as we progress and towards the end, I would like to talk to you about a potential physical therapy program to help you with your gait so that we can prevent falls going forward.
That would be great.
Oh, wonderful. I'm glad you're open to it.
Yes.
It says here you're not allergic to anything. Is that correct?
That's correct.
Very good. And for the medications you take, are you still taking 80 milligrams of atorvastatin daily?
I am.
And gabapentin, 800 milligrams 3 times a day?
Yes.
Okay, so you must be having some nerve issues. I see you take metformin daily with breakfast.
I do.
Okay. And are you still taking the Imdor daily, or the isosorbide mononitrate?
Yes.
Okay, that's from your cardiologist?
Yes.
And I also have metoprolol once daily, the
Yes.
25 milligrams. Very good. And let's go over your team of doctors. Your primary doctor, we don't have one listed in here. It's listed as me, but I know that's not correct since this is my first time seeing you. Who is your primary doctor?
Dr. Melissa Love.
Very good. Oh, let me put her in the PCP line. Very good. So we've updated your primary care provider, and then my understanding is Dr. Rich is your cardiologist. Is that right?
That's right.
All right, I'm going to add him to your care team.
Okay.
Do you see any other specialists regularly?
No, not regularly, no.
No? Okay. For your non-medical history, have you ever had any surgeries in your life?
Oh, I've had a few in my life.
Okay. What have you had?
So I had my gallbladder removed 6 years ago,
Okay.
and I had carpal tunnel surgery about 15 years ago on both hands.
You said 15 years ago?
About 15 years ago.
Very good. And did you have a joint replacement in one of those knees? I thought I saw that in your record.
Yeah. Yes, I did.
And is that the same side that you were feeling the weakness on?
It is the same side that's giving me trouble.
Okay, which side is
The
that?
left side.
There, that's what you said. Thank you. And let's talk about your family medical history. We actually don't have much information. Are either of your parents still living?
No.
And do you know how old they were when they passed, or how they passed?
Yes. My dad was 60 actually when he passed. He was young and he had pulmonary fibrosis. And my mother passed 3 years ago of a cardiac episode.
And how old was she?
I think 92.
Very good. I'm sorry for your loss. Do you have any brothers or sisters?
I have one sister.
And she's still living?
She is.
How's her health? Does she have any issues?
She is a diabetic.
Okay.
She's 71.
Were either of your parents diabetics as well?
No, but our grandparents were.
Okay. And do you have any children?
I have 4 sons.
4 sons. How's their health?
Oh, they're great.
They're all in good shape? Wonderful. Do you drink alcohol?
Well, every now and then I go have a little wine with the girls, maybe once or twice a week.
Okay. And when you have a drink, how many drinks do you normally have?
Oh, just one.
Just
because I'm
one.
driving.
Okay. And do you drink wine, beer, liquor? Does it change?
It changes.
Okay. Are you currently sexually active?
No, I'm not.
Do you have any current or historical drug use history?
No,
No drug use? Okay.
none at all.
Were you ever a smoker?
Oh, no.
Very
Never did
good.
like the smell of smoke.
And what about chewing tobacco, smokeless tobacco, anything like that?
Oh, no.
Very good. And I know you're not drinking much these days. In the past, was there ever a time you felt concerned about your drinking or felt you needed to cut down?
No, never.
And were you ever annoyed at somebody criticizing you for drinking?
No, never.
Have you ever felt guilty about your drinking?
No,
And were you ever drinking early in the morning to get rid of a hangover or kind of steady your nerves?
no.
Very good. And we're going to go over your medical history. I know you've got coronary artery disease with a little chest pain. Is that correct? That's why you're taking the Imdur?
That's right.
Since you've been on the Imdur, has the chest pain gotten better?
It is better.
Wonderful. Glad to hear it's working for you. You've never had a heart attack, have you?
I have not.
Very good. And You are taking medication for diabetes, so you're aware of that diagnosis.
Yes.
Any history of any mental health issues, depression, anxiety, bipolar disorder, anything like that?
No, not that I know of.
Okay. And any problems with any issues in your blood, any history of anemia, immune disorders, anything like that?
No, none.
Do you have a history of any serious GI problems, IBS, pancreatic disease, hepatitis, pancreatitis?
No.
And have you ever had any forms of cancer, skin cancer, perhaps cervical cancer, breast cancer, any personal history of cancer?
No.
Very good. Do you exercise regularly?
Well, I just walk the dog around the block, but I'm getting a little slower at that now.
When you go, do you feel like it's at a brisk pace, or is it sort of slow and casual?
It's slow and casual.
You're not kind of huffing or puffing?
No, I am not.
Very good. All right. And I'm going to ask you a little bit more about your activity level in a few minutes. Currently, on a scale of 1 to 5, can you rate for me how hard is it to pay for your basic living expenses if 1 is not hard at all and 5 is very hard?
Probably 2.
Okay, so not very hard.
No.
In the last 12 months, was there a time you were not able to pay your mortgage or your rent?
No, never.
And was there a time that you didn't have a steady place to sleep overnight?
No.
Have you had to move in the last 12 months at all?
No.
In the last year, have you had any problems with your transportation that's kept you from getting to medical appointments or from getting medicine?
No.
And have you had any transportation issues that have kept you from getting to the things that you need to do every day, the store, maybe some meetings, work, anything like that?
No, I still drive all
Wonderful.
to my appointments and to do my errands.
Have you been concerned at all in the last 12 months that you're going to run out of food at your house and not have the financial resources for more groceries?
No, not at all.
And has it occurred that you've run out of food and not had money for groceries?
No.
Again, on a scale of 1 to 5, where 1 is none at all and 5 is very much, can you tell me how much stress do you have in your daily life?
About a 1.
Wonderful, that's nice.
Yes.
And in a typical week, how many times in the week do you talk on the telephone to somebody who's a friend or family member or neighbor?
Oh, I do that every day.
Oh, that's good. And how often do you get together with friends or relatives socially?
Probably 3 or 4 times a week.
Wonderful. Are you going to any sort of church or religious services regularly?
I go every Sunday to church.
And do you belong to any church groups, social clubs, organizations, anything like
I
that?
do the welcome committee at church.
And how often does that committee meet?
We meet every other week.
Okay. Have you ever been married?
Yes, I have.
And currently, are you divorced, widowed, separated?
Divorced.
And you said you drink a couple times a week.
A couple times.
You never have more than 6 drinks in one setting.
Oh, no.
Okay, just making sure.
Yeah. No, I have to drive.
Getting back to your health status, I know you've got diabetes. Has your eye doctor ever told you that you have any eye problems caused by diabetes?
No, and I stay pretty current with those appointments, so no, I haven't heard that.
Very good. I didn't add your eye doctor in. Can you tell me the name of your eye doctor?
Yes, Dr. Wu. It's W-O-O, Cindy Wu.
Okay. I can't find Dr. Wu in our system now, but I'll make a note to update it later.
The clinic is Eye Medical Center.
I'll make sure we get that added in.
Okay.
Do you regularly experience a sense of numbness or tingling in your arms or your legs?
No.
And do you ever get a burning sensation in your hands or feet?
No.
Do you regularly experience pain in your calves or your thighs, maybe while you're out walking the dog?
Sometimes on that left side, I'll
Is
have
it
that.
sort of a cramping pain?
Yes.
Okay. And When you're relaxing at home, you have your feet propped up, you're resting. Do you ever get leg cramps or leg pain that is only relieved if you sort of stand up?
No, I haven't noticed that.
Very good. Do you have a persistent cough that's lasted for longer than 3 months and has been there for more than a year or two on and off?
No.
Okay. And you don't have any surgically created openings in your body, do you? I didn't see in your surgical history.
No.
But you do have that knee implant.
Yes.
Any complications from that?
No, actually the surgery was great. The recovery was great.
Wonderful.
So just this last couple of months.
Just the little weakness that you've had recently.
Yes.
And have you ever used oxygen at home?
No.
So you're not currently using it then?
No.
Very good. In the last 2 weeks, can you tell me, have there been times where you felt bothered by a loss of interest or a loss of enjoyment in doing the things you normally like to do?
No, I stay very busy.
Wonderful. And in the last 2 weeks, have you been bothered by feeling down or depressed or hopeless even?
No, not at all.
Very good. All right, we're going to do a little test of your mobility today. I know that you've had these falls, and I just kind of want to get an idea of how you are moving today. So this test is called a timed up and go test. And the way that it works is when I say go, I'm going to have you stand up, walk the 10 feet to the other side of this room, turn around and come back and sit down at your normal pace. Now I'm going to time you, but I don't want you to feel rushed, okay?
Okay.
So when I say go, I'm going to have you stand up, walk the 10 feet across the room to the line on the floor, turn around, come back and sit down, and I'm going to time how long it takes, okay?
Okay.
Ready, set, go. Wonderful. So that took you 12 seconds, and 12 seconds is the cutoff for normal for a time up and go test, so you are moving fairly well, and it looked like today your balance was good. But what I was hearing is that it kind of comes and goes with that weakness, so I still think physical therapy would be a good idea since you were at the upper limits of normal.
Okay.
The next thing we're going to do today is what's called a whisper test. And the way that it works is you're going to plug one of your ears, and towards the ear that's not covered, I'm going to whisper 3 letters or numbers like F5L. And I'd just like you to repeat what you hear me whisper, okay?
Okay.
So, perfect. I need to be about arm's length away from you. R52.
R52.
Very good, and let's try the other side.
Okay. J93.
Excellent, your hearing is quite good. The next thing we're going to test today is your short-term memory. Have you noticed any problems with your memory recently?
No.
Very good. So the way that the memory test works, I'm going to tell you 3 words I'd like you to remember today. I'll have you repeat them back to me, and then in about 3 minutes, I'm going to ask you again what the words are. And in those interim 3 minutes, I'm going to distract you with some other questions, okay?
Okay.
So the words I'd like you to remember today are mountain, apple, and child.
Okay.
What are they?
Mountain, apple, child.
Very good. For your next little test, I'm going to have you take this circle and draw on it to make it look like a clock. I'd like you to put all the numbers that go around a clock, and then I'd like you to set the time for 10 minutes after 11, please.
Okay.
Excellent, Miss Sarah. That is a great looking clock. Thank you.
Okay.
I am going to upload that to your medical record after the visit today.
Okay.
Now, in the past 3 months, Have you noticed that your food intake has declined due to any problems chewing, swallowing, or digesting food?
No, it hasn't.
And in the past 3 months, have you experienced any unexpected or unintentional weight loss?
No, none.
Okay. And we can actually go back, and if you have previous readings, look at how your weight was. So it looks like you did lose a little bit of weight according to these records, but again, this is a test record, so
Okay.
we'll go with what you're saying today. Are you able to get out of the house by yourself? You said you're driving and things like that?
Yes, I do
okay.
that just fine.
And have you suffered any psychological stress or acute disease in the past 3 months?
No?
You've never been diagnosed with depression or dementia, have you?
No.
I didn't think so. And let's see, your BMI today is 36.5. Do you remember the 3 words that I told you?
Mountain apple child.
Excellent. Your cognitive test is quite normal. You did very well on that.
Good.
So that's good news.
That is great news.
Now, currently, you said you're not using a cane or a walker.
That's right.
Do you ever need help to get out of bed or get dressed?
No? No.
And I watched you stand up all by yourself today, so I know you can do that. When you have to use the bathroom, do you ever have problems of leaking urine before you make it? Or if you cough or sneeze, does a little urine leak out?
Well, sometimes when I cough or sneeze, yes.
Okay. And what about with your bowels? Do you ever have any problems with stool leakage or accidents with your bowels?
No, none at all.
Now, that kind of incontinence that you just described, that's what we call stress incontinence. It's where if you cough, the stress against the pelvic floor causes a little urine to leak. Has anybody ever talked to you about Kegel exercises?
Yes.
Okay. And do you do them?
Well, not regularly.
Okay. When I give you your instructions today, I'll make sure to include some information just in case you need a refresher on how to do them. Are you able to feed yourself?
Yes.
And do you do your own housework?
Yes, I do.
Okay. Can you use a telephone without assistance?
Yes.
You do your own grocery shopping.
My own shopping, yes.
You pay your bills all by yourself.
All by myself.
And do you need any help to take your medications?
No.
Very
I put them in the little pill box.
You set them up by yourself?
Yes.
Very good. Now, I know you said you weren't getting any sort of exercise recreationally, but you do go out and walk the dog.
Yes.
How many days a week are you walking the dog?
So 7 days a week, probably 5 times or so.
Oh, you're very active with that dog then.
Yes.
And how long is the walk? Is it 5 minutes, 10 minutes?
It's probably just 10 on the top side.
Okay, so 10 minutes, 5 times a day, 7 days a week. Very good. And you said you do your own housework. How much of the day, on a typical day, do you spend doing housework or domestic chores?
Probably just an hour, hour and a half or so.
And how many days a week would you say you do that?
Probably 3 or 4.
Okay, and would you describe that activity level as vigorous or moderate?
Moderate.
So you said about an hour and a half, 3 days a week on an average week?
Yes.
Very good. And do you do any activities that you would consider vigorous that involve lifting very heavy things or running or?
Well, no, not really anything vigorous. I work in the flower bed, but that's not very vigorous.
How many hours a day would you estimate on a typical day that you spend sitting or reclining?
Oh, maybe 3.
Okay. We did your hearing test and you did quite well, so I know you're not seriously hard of hearing. You're not wearing a hearing aid today?
No.
Okay. And do you have any serious vision difficulties?
No, not at all.
Wonderful. Because of any physical, mental, or emotional conditions, do you find it hard to concentrate, remember, or make decisions for yourself?
No, no.
Do you have difficulty climbing stairs?
Well, just when I have that little weakness sometimes.
Okay, so it's not a serious problem, it's an occasional
occasional
issue.
problem. Yeah.
Do you have difficulty bathing or dressing yourself?
No.
And because of any mental, physical, or emotional condition, do you have a hard time running errands by yourself?
No, I enjoy my errands.
Okay. In the last 6 months, have you broken any bones?
No.
No, very good. And let's take a look at your health maintenance. This is going to tell us what you're due for. It looks like you're due for a foot exam. We can do that today.
Okay.
You're due for your mammogram, so I'll get that ordered for you.
Okay.
You are due for the shingles vaccine, and you're also due for the second dose of the COVID vaccine. What I recommend we do today is get you that second COVID vaccine and postpone the shingles vaccine for about 6 weeks, just to make sure the COVID vaccine has time to take effect. So we'll postpone the shingles one till next month. And I'll have the nurse come in and give you the COVID vaccine at the end of the day.
Oh, perfect.
Before we move on to your physical exam and your foot exam and all of that, I did want to take this opportunity to talk to you about something called advance directives. Because this is a wellness visit, it's something we like to talk about. The advance directives are a way to put in writing a plan for if something were to happen to you health-wise, who would make your healthcare decisions? Who would you want to be in charge of that? Would you want life support? Those sort of issues. Specifically, I'm talking about a living will and a healthcare power of attorney. Now, according to our records, you do have some documents on file. It says you have a living will. We got it a little while ago, and it says that you would like life support if you're able to improve according to your doctor's estimation. Is that correct?
That's correct.
But we don't have we don't have a healthcare power of attorney on file for you. So I would like to go over that paperwork with you today if you're interested.
Sure, that would be great.
Okay. So this is the form I'm talking about. And since you have multiple children, this may be important for you because you don't want them fighting over who's making the decisions. So what this says is if you're unable to make your own healthcare decisions, you elect this person as your primary healthcare decision maker. You do get 3 choices, so that if the first person is unable or unwilling to do it, we can call the second choice, and if they're unable or unwilling, we can call the third choice.
Okay.
Now, if something should happen to you, this person who's the highest ranked gets to make all of your healthcare related decisions. So it's very important that in addition to filling out this paperwork, you have a conversation with the people that you elect for this position so that they know what your wishes are.
Okay.
When you sign it, if you don't want to make a decision today, you will have to find 2 witnesses who are neither related to you by blood or marriage to witness this and who won't inherit anything upon your death. Okay? If you want to fill it out today, my nurse and I can be your witnesses.
Okay.
Okay? And then this is the living will. This is laying out a situation in which you have an incurable injury, disease, or illness with no chance of recovery as determined by a team of physicians, and that your death will occur with or without the use of life-saving procedures. In that case, the use of medical procedures would only artificially prolong the dying process, which is, of course, not the purpose of medicine. However, you still have a choice. So, option 1 says all life-sustaining procedures, including nutrition and hydration, will be withheld or withdrawn. And option 2 says all life-sustaining procedures except nutrition and hydration would be withheld or withdrawn so that food and water could be given to you through invasive means. And what this means is if you're going through the dying process and you opt for the second choice, we will continue to give you tube feedings and IV fluids if you can't feed yourself. I don't want to decide this for you. It is not our place. But take this home, consider what you'd like, and when you're ready, sign it in front of your 2 witnesses, okay? So we'll leave this here for you to take with you when you go today, and I'll give it to you with your visit summary. From here, we can go ahead and do your foot exam and your physical exam, okay?
Okay.
Start out just by listening to your heart and lungs.
Okay.
You can breathe normally. Very good. And take some big, deep breaths for me. Good. I'm going to have you lift your legs and just kind of lean back a little bit. I'm going to listen to your belly.
Okay.
Normal bowel sounds. And since you're due for your diabetic foot exam, I'm going to check your feet today, okay? You've probably had one of these tests before. But if you haven't, the way that it works is I'm going to touch your feet with this small little monofilament. It's a small piece of plastic. Looks like this. And I want you to close your eyes and just give me a signal if you feel me touching your feet. You can lift your hand or you can say yes, whatever works for you, okay?
Yes. Yes.
And I'm just going to feel your pulses. Oh, you've got good blood flow. And you've got good sensory perception, so not too much damage. That gabapentin that you're taking, is that because you were having some tingling feelings in your feet?
It is.
And they've gotten better since you've been on the
much
medicine?
Better, yes.
Wonderful. Very good. All right. Let's get your shoes back on. Might need your help with that. There we go. And we can step back down. Thank you. All right, your physical exam was very good. Everything looked normal.
Oh, great.
So we're just getting ready to wrap up here. And I'm going to open the Smart Set and put in the order for your mammogram. And we discussed your advance directive, so I'm going to document that. You did mention a little urinary complication, so I'm adding that to your diagnosis list as well as the history of falling.
Okay.
And I'm just putting in your order for physical therapy. What region would you like to get that done in? Do you want to get it done in New Orleans, up in the North Shore, Baton Rouge? What's convenient for you?
Baton Rouge works great.
Baton Rouge? Okay. The physical therapy department will call you about that, so
Okay.
they'll reach out to you. And I'm just going to update your problem list and make sure everything is up to date, because when we document correctly, it does really help improve care between your doctors. So you've got the high blood pressure, high cholesterol, the coronary artery disease. And I'm marking it with angina since you do take that Imdur that's controlling the chest pain.
Okay.
And even though the neuropathy is controlled with the gabapentin, I am going to make sure we document that today since you were having the pain previously.
Okay.
Looks like your BMI today is 36.5, which does place you in the class of severe obesity, so I'm going to make sure we note that on your chart as well. Maybe once you finish the physical therapy program, you'll be a little bit more comfortable walking on your own, and you can increase the pace of the walk you do with your dog for some more exercise, because you are getting a good amount of activity. We just need to make sure that it's enough to prevent you from falling in the future.
Perfect.
And the number one way to prevent falls is regular exercise.
I did not know that.
Mm-hmm. All right, let me just make a couple of notes here. I'm going to make sure that we document your foot exam so that it doesn't keep saying that you're due for it when you log into your My Ochsner account. We tested 6 sites and no deformities. Your pulses were normal. Skin looks good and your toenails looked good.
I did have a good pedicure, didn't I?
It looks great. All right, so the foot exam is now satisfied for the year. The mammogram is ordered. When the nurse comes in and gives you the COVID shot, you can talk to her about scheduling your mammogram, or you can check out and they'll do it at checkout today. Okay. You'll get a copy of your visit summary and you can take it home along with these advanced directives. It'll have an updated list of your medications and it'll have a preventative health plan, including the things that you're due for, like the mammogram. And it will list your COVID vaccine on it because I'm printing it out before she's going to be able to log the vaccine. But you'll know that this is your second dose and you've satisfied it all.
Great.
All right, Miss Sarah, we've got most of your diagnoses updated. I'm just going to do a little search of your history to make sure there's nothing we're overlooking. I know there's some common things that tend to get missed. And when I search for aorta in your chart, it does show that you have some calcified plaque in your thoracic aorta. I want to make sure that we include that because that is a high-risk diagnosis. It looks like my computer froze. Just a moment. There we go. I'm also going to review your recent labs and make sure there's nothing that we've overlooked. Oh, well, it looks like your glomerular filtration rate is slightly reduced. What that means is your kidneys aren't functioning at quite the level that we expect for someone of your age. You also have a slightly elevated hyperparathyroid hormone level. Those haven't been reflected on your problem list, so I'm going to make sure to add them. You also have an abnormal CBC that has a reduced platelet count, so I want your problem list to reflect all of these issues. All right. The low platelet count or thrombocytopenia we will add to the problem list. I'm going to add the chronic kidney disease, which is what we saw with the reduced filtration rate that I mentioned. And I'm going to add the elevated hyperparathyroid. I want to make sure that we're prioritizing the list of visit diagnoses today because often Medicare will only look at the top 12 diagnoses in a billing code. And so the high-risk ones we want to make sure are in the list of first 12. Additionally, since this is a preventative healthcare visit, we want to make sure that's the primary diagnosis. It looks like that should cover all of your major health issues and paint the picture of your health for the next year. Now, let's go through the documentation. I'm going to refresh the note from earlier and add a follow-up date because I would like to see you back next year for this visit again. All right, we've got your physical exam diagnosis. All right, we've got your physical exam documented. And now I'm going to add some information on each diagnosis code that I dropped. So for the encounter for preventative health, we'll just note that we performed the screenings today. Most of your conditions appear to be stable, and I know your PCP Dr. Love is following them, so I'm just making a note that that's what we're doing this year for them. For the aortic calcification that we are adding to your visit diagnosis list, you're already on a statin, which is the treatment that's recommended for that issue. For the history of falling, we are referring you to physical therapy, and as I said, they will call you. Is there anything else I can help you with today before my nurse comes in?
I don't think so. This was great, really.
Well, thank you so much for your time, Miss Sarah. I do appreciate it, and I wish you all the best. I look forward to seeing you again next year, and good luck with the physical therapy program. If I hear from your physical therapist that you need some sort of assistive device, a cane or a walker, we'll make sure that we get that ordered through your primary care provider.
Okay.
Okay?
Very good.
Thank you so much. It was a pleasure to meet you.
Thank you.
Bye-bye.
Bye.